Hello, and you are welcome to today's lesson. Today we are going to look at resuscitation. After the baby is born, the baby has to be resuscitated so that it will enable the baby to survive. So we are going through our objectives for the day. By the end of the lesson, students should be able to 1. Define resuscitation, list the requirements for resuscitation, demonstrate the procedure for resuscitation, and then we move on. So we are going to take the first one. What is resuscitation? It is an emergency procedure which is being carried out to restore and maintain respiration and then circulation after breathing ceases and then the heart also stops beating. So we are looking at these keywords: resuscitation, restoring and then maintaining respiration. And then we come to circulation. So the moment you restore the person's respiration, you need to maintain it so that the person will not go back to the worst state. So that is resuscitation. So we carry it out when the heart also stops breathing. So when the baby comes out from utero, baby has been assimilated with some of what fluids. So we need to resuscitate. We need to stimulate the baby to breathe so that the baby will survive. What are the requirements for resuscitation? So we need a table with a radiant heater. We also need an oxygen point, a manometer to regulate the breathing in every aspect of the baby. We also have to suction the baby, so we need a suction machine. We need a clock that we can time the baby, the first minute, the 5th minute, and then the rest. We also need a shelf to provide a firm surface to enable about 15 degrees held teeth to be achieved. We need 2 straight blade infant laryngoscope. We need a spare batteries for our bulb, the neonatal and the trachea tube, and then a well-lit resuscitation area. Let's look at the procedure. What are the procedures that we need to follow when we are doing resuscitation? We have all our requirements now. The baby should be placed on a flat, firm surface at a comfortable working height and then under a radiant heater source to prevent hypothermia. You know, when the baby comes out, we need to wrap the baby because the baby is coming from a different environment to another environment. And we need to maintain the warmth that the baby is enjoying in utero. So we need a radiant heater to provide the warmth for the baby to prevent hypothermia. Then the baby's shoulders should be elevated on a small towel to straighten the trachea by slight extension of the head. So when you do that, this allows the airway to be open so that oxygen can be passed through and then the baby will be able to breathe well. We should also hyperextension and then stretching of the spine and hips is painful and risks the babies or the infants being dropped. Now, the next one that we have to look under the procedure is clearing the airway. If there are meconium present in the airway, we need to suction under direct vision. Should be performed by passing a laryngoscope. The laryngoscope will allow us to see the larynx and then the trachea so that we'll be able to suction the baby to prevent any meconium aspiration. Care should be taken to avoid touching the vocal cords, as this may induce spasms and then apnea. Because if you go in deep, spasms may occur and then the baby will be suffocating and will not be able to breathe. We don't have to force the baby, so no force should be exerted while passing the catheter, as this could cause trauma to the mucosa, predisposing the baby to edema, bleeding, and then increased secretions. Thick meconium may require to be washed out of the trachea with normal saline through an endotracheal tube. So if we have enough meconium in the airway, we need to do lavage or washout so that the baby will be able to take in what? Normal air, which this meconium will not go and then occupy the alveoli. Stimulation. Rough handling of the infant serves as what? Increased shock. So as we keep on handling the infant roughly or mishandling the infant, it may prone the baby to shock. So we need to minimize the handling of the baby. Gentle stimulation by drying the baby and then clearing the airway should be what? Surface. Directing a low flow of oxygen over the baby's face may stimulate a GAPS reflex. So we need to ensure that there is an oxygen point to provide oxygen for the baby. Warmth. You know the baby is moving from one environment to the other. So we need to provide warmth for the baby. Hypothermia causes hypoxia, as is essential oxygen, and then glucose can divert from the vital centers in order to create heat for survival. So we need to wrap the baby the moment the baby comes out from the uterus. Wet towels should be moved and the baby body and head should be covered with a warm blanket, leaving only the chest exposed so that we can observe the rise and fall of the chest. Let's look at the daily care of the baby. Now we finish with our resuscitation. How do we care for the baby? We are looking at the daily care of the baby. So with the resuscitation, you have to make sure that all the necessary requirements are present so that you maintain the work and then the survival of the baby. Daily care of the newborn. Grooming and cleaning the baby. We finish with our resuscitation. Baby is now stable. Baby is breathing well. How do we care for the baby? The newborn are highly susceptible to infection, and the need to maintain good personal hygiene. We have to ensure good hand washing, prevent people with upper respiratory tract infection, GIT abscess, skin rashes, or any cut from entering the room where the baby is being kept. Daily or each other day bathing of the baby. So it's not necessarily bathing the baby every day. From the day that the baby is born till the time that the cord is off, we top until the baby. We normally start from the head downwards. Diapers should be changed and then clean the baby after each bowel movement. If the infant has been circumcised, the penis should be checked for any bleeding and then apply sterile gauze with petroleum gel that may be applied to the area to prevent any further bleeding and then promotes wound healing. The mother should be taught to apply Vaseline or other recommended ointment to the surgical site after each diaper change for about 2 weeks until healing is complete. Cord care. The diaper needs to be folded to provide air circulating around the cord. So we don't have to cover the cord. We need to dress it and then allow the cord to dry. The cord should be cleaned daily with hydrohexane or methylated spirit. That will dry the cord and then the cord will tear off. Make sure the spirit or the hydrochlorosine damazine that is being used or applied to the sides of the cord next to the skin. When we are using the chlorohexazine, we don't have to allow it to touch the skin of the cord, just the cord. So you hold the cord and then you apply it from the base up without the hexazine touching the skin. Small amount of blood may be on the diaper when the cord is off. Continue to provide care for the cord after the cord falls off until the skin appears normal. Never force or pull the cord off or even attempt to loosen it. When force is being applied to the cord, bleeding may occur and then there will be cord sepsis. So they need to care for the cord very well to prevent cord sepsis. Weight measurements, we've done it when we were doing the assessment of the newborn. Using the APGAR score, we need to take the weight, and we've done the weight measurement already, where you have to make sure that you have good light, you have the weighing bin or the scale that you need for the weighing, and then you follow the procedure step by step. So you refer to your previous notes for weight measurement. Breastfeeding, another important aspect of the daily care of the newborn. With breastfeeding, we'll be looking at what breastfeeding is, the definition, and then the components of breast milk. We also have to list the benefits of breast milk to the infant, the mother, and then the nation. So straight away, let's look at what breastfeeding is. Breastfeeding is an art of feeding the baby directly from the breast. So we can feed the baby in different forms. We can express the breast milk and then we feed the baby in cup and spoon. Some people use feeding bottle, which we are advising against now. So feeding the baby directly from the breast is what we term as breastfeeding. It is a natural and perfect food for the baby because it contains all the nutritional values. There is no need for you to measure anything. Everything is being measured and it comes in their right and then the quantity of nutritional values. It is also universally accepted. So it is being practiced everywhere in the world. There are two main forms. We have the colostrum and then the matured milk. So we'll be looking at the colostrum. The colostrum is a clear and yellowish fluid secreted in the breast from the 16th week of gestation to the second day post-delivery. So you could see that The colostrum starts its production right from pregnancy, the 16th week, when you start having the fetal movements. Then the milk also starts producing. So we have this colostrum from the 16th week of gestation till the second day when the baby has been delivered. It is the first production of the breast, and it is thicker than the matured milk. Some of them say it's contaminated, so when they start seeing this yellowish color of breast milk coming out, they dispose it off. So we are encouraging that this milk is very good, and it contains all the nutritional values that the baby needs till the breast milk is well matured. It is secreted in small amounts, enough for the baby, and gradually replaces by matured milk by the 3rd day of delivery. It contains nearly 3 times the amount of protein and fat than the actual matured milk. It has a laxative effect and keeps secretory ducts open. Laxative effect in the sense that this colostrum helps the baby to clear all the meconium, which is the first stew passed by the baby. And we've established that one in our previous lesson, that this meconium is being passed by the baby till the 3rd day. And then is the effect of this colostrum that helps the baby to pass this meconium. And so we are saying that this colostrum has a laxative effect, which keeps the meconium from the system, and then all secretory ducts, especially in the breast, open, so that the matured milk can also flow. Good. Its sugar content is less and easily digestible and absorbed into the tissue or circulation very fast. Carbohydrates in the colostrum is 7%, mineral salts 0.2, water content 87. And that is why we are saying that the baby is not supposed to take in any other food or water at birth except the breast milk, because the water content is enough to satisfy the baby's taste. Fat content is 3.5, protein 2.3, and then we also have our vitamins A, B, C, D, and E, and then that of also vitamin K. While with vitamin K is a little bit low, and that is why when the baby comes out, we need to inject the baby with vitamin K to help in the clotting mechanism of the baby. So, we need to explain to the mother the breast milk does not come until the 2nd day or 4th day. So some of them will be worried. Why is the breast milk not coming? Baby need food. But we encourage them that they put the baby to breast. This small amount of colostrum that will be flowing from the 2nd day to the 4th day is enough to keep the baby satisfied. Breast may be firm but feel soft after the nursing or feeding baby. We need to nurse the baby at least 10 to 15 minutes on each breast. To prevent nipple tenderness or nipple crack or pain on the nipple, we need to hold the baby correctly. We need to cuddle the baby. Either we use the cradle hold, football hold, or side lying. In this position, used in taking care or breastfeeding, comes in various ways. And then you need to adapt the one that best suits you. Make sure the baby lips are behind the nipple and circling the areola. The areola is the darkened parts around the breast. After nursing, we need to express a little of the breast milk, and then we allow it to dry. Most of the time, the babies are not able to suck the breast because they lack energy, so they don't satisfy after breastfeeding. So we need to express the breast milk, and then we feed the baby with the expressed breast milk using cup and spoon. Do not use soap or alcohol on the breast. Some people may say that we've sweat for some time. We need to wash the breast before we breastfeed the baby. But we are saying that you just clean the breast with towel and then water. But we don't use soap or alcohol in cleaning the breast. After we feed the baby, we need to burp the baby down between the breasts, at least at the ending of each feed. This will help the baby to prevent any aspiration, so that we'll have aspiration pneumonia. So to prevent this aspiration pneumonia, we need to burp the baby in between feeding. What are the functions of the colostrum? What does the colostrum do to the infant within the first 3 days? It is rich in growth factors, which stimulates the baby's immature intestine to grow. Get to know that when the baby comes from the uterus, everything of the baby is sterile. Baby is using the placenta and then the blood in utero. Now, baby is out. Baby has to feed on his or her own. So we need to mature everything in the infant. So feeding on this colostrum will stimulate the intestine, the GIT, to mature so that the baby will grow. It also clears the lactiferous ducts. And we have these lactiferous ducts in the breast tissue. This enables it to have free flow of milk during the puerperium. And the puerperium is just from birth to the first 6 weeks of the baby's life. The colostrum also nourishes the baby until the lactation is well established. We talk of the matured milk. So with the colostrum, it helps the baby so that the milk will continue to flow until the breast milk is well established. It also contains antibodies, which serves as immunity to fight any form of infection that the baby may encounter. So some of them will say that the colostrum is dirty, the breast milk that is flowing is dirty. So they express it and then throw it away, which is wrong, because this dirty milk contains antibodies which fight against infection. It also acts as a laxative and helps the baby to pass all the meconium within the first 3 days. So these are the functions of the colostrum. 1, it is rich in growth factors which stimulates the baby's immature intestines to grow. It clears the lactiferous ducts so that milk will flow freely from the puerperium period. It also nourishes the baby until the lactation is well established. It contains antibodies which help the baby to fight infection. It also acts as a laxative to clear all meconium from the baby within the first 3 days. Good. Now let's look at the matured milk. We are saying that the colostrum is thicker than the matured milk. This matured milk replaces the colostrum on the third day post-delivery. It looks thinner than the colostrum and then the cow milk. It looks grayish white and watery and contains all the nutrients needed by the baby to grow. And that is why we are saying that you don't need any measurement for the breast milk because it contains all the nutrients in their right amount and then quantity and quality. The water component is adequate enough to satisfy the baby's taste. So there is no need for us to be giving the baby water during the first 6 months of life. What are the benefits of the breast milk to the baby? So we are looking at it. What are some of them? 1, protection against diarrhea diseases in the child. So the moment the baby comes, giving the baby the breast milk for the first 6 months, it prevents the child from any diarrhea diseases. Get to know that the breast milk itself is a form of laxative for the first 3 days of life for the baby. And this breast milk contains antibodies and then immunoglobulins which fight against any infection that the baby may encounter. It also prevents dehydration in the child. Bear in mind it contains all the sodium, all the minerals, the potassium that the baby needs. So any form of what? Dehydration, we have enough water in the breast milk, which also prevents the baby from dehydration. It also promotes the infant's growth. We have the protein, we have the fat in the milk, which promotes the immature intestine to grow, and then the general well-being of the baby, because the nutrients in the breast milk are easily digestible, and then they are being absorbed quickly into the tissues to promote growth of the infant. Good. Now, it also protects against any allergy. If the child is being breastfed well, any form of eczema, fever, whatever skin rashes, the skin is also being protected. They also have protection against systemic infection. So even if there are any form of, as you are saying, in daily care of the infant, if there are anybody coming to attend to the baby with any skin rashes, any upper respiratory tract infection, any diarrhea diseases that the person is having, if the baby comes into contact with this person, the breast milk alone will be able to fight the infection. The breast milk also prevents the issue of anemia in the infant. So there is no way that the baby will come with any form of what? Anemia. And this can be well achieved when we have what? Vitamin C in abundance in the baby. And how do we get our vitamin C? Through the mother taking in enough what? Vitamin C. So apart from these benefits, we also have other benefits such as what? Right composition and temperature. This is not the time that you are now going to say that I'm going to warm the breast milk. No, I'm now going to measure the amount of protein in breast milk. I have to give these kind of things before I'll be able to achieve this amount of protein or carbohydrate. No, the breast milk contains all the nutrients in their right composition and temperature. Because when you are feeding the baby, you prepare any food or formula, you need to what? Assess the temperature, check the temperature, and see if it's at the right temperature before you feed the baby. But with the breast milk, There's nothing like going to check the temperature of the breast milk, because in utero, the baby have adapted to the mother's temperature, right? So everything within the mother is suitable for the baby. So there's no need for you to check the temperature of the breast milk before feeding the baby. And they come in their right composition. It is also rich for the baby. It reaches the baby directly from the what? Excretory duct, fresh and then sterile. So there's no contamination. As when we are using the feeding bottles, the cup and spoon, when you express it and the cups are dirty, the bottles are dirty, we don't wash it well. We don't decontaminate it well. We don't disinfect it well. They carry microorganisms, which brings about infection in the child. So with breastfeeding, for the first 6 months, we are saying that it reaches the baby directly. And then there's no form of what? Contamination. And then it comes in fresh and then sterile. The breastfed babies are always healthy and more resistant to infections than babies who are breastfed with, they are fed with what? Bottles or cup and spoon in the first year. So if you feed your baby very well with the breast milk, you could see that within the first year of life, hardly do the baby or the child fall sick, that you'll be rushing to the hospital day in and day out. Recently, a lady gave birth, and I just advised the lady, keep on giving the breast milk. And she was able to do well with the breastfeeding for 6 months. And up to now, the child is 1 year. The child has not visited. Even all the vaccination, the child will take it without any temperature, without any pain. The next day, the child is fine. There's nothing like infection. There's nothing like diarrhea. So the mother was just telling me that, oh, sister, it's a good advice, and I practice it. And the child is healthy, bouncy, big. So if you're able to breastfeed the baby very well, exclusively for the first 6 months of life, the baby look healthier, and then you prevent, or the baby is able to resist any form of what? Infection. Now let's look at the benefits to the mother. Do the mother also have to benefit from breastfeeding? So what are some of the benefits that the mother will also get when the mother is breastfeeding? We are saying that it's cheap to produce. You don't have to get up and then take money and then go and buy breast milk. The only thing you have to eat well, relax, and then rest enough. Because breastfeeding is what? Psychological. And that is why when it comes to breastfeeding, you need to tell the mother as to what to do, how to go about it. You need to psychic the mother that when you give birth, you will breastfeed the baby for the first 6 months without any food, without any water, so that the mother will tune the mind that, yes, when I give birth, I'm going to breastfeed the baby. So it's psychological. Physiology of lactation deals with the brain. It's not a matter of the amount of food that you eat. No, it's the brain, and then rest. So if you're able to feed well, you rest enough, and then stress-free, the production of milk increases, and then the baby will have enough breast milk. So there's nothing like you going to buy breast milk. And it's also convenient at your own disposal. Not that you are now going to cook, put on fire, buy gas, buy a formula, prepare warm water, test the water. No. Some of even the water that we are using, most of them are what? Contaminated. So we need to what? Sterilize the water before we use it in cooking. Our environment needs to be clean. But with this breastfeeding, it's so convenient, so cheap, and it also saves time. It saves time and energy. We are saying that breastfeeding to the mother, the benefit It's cheap to produce, convenient, save time, and then energy. It also helps with what? Evolution of the uterus. When you give birth, the body system, because of physiological changes, all the systems in the body have a different shape. But after birth, and then you are breastfeeding, the uterus have to go back to its normal position. And with the help of the breastfeeding, the uterus, which now becomes an abdominal organ, slowly and gradually evolves into its normal position in the pelvic brain. It also serves as a family planning method. Why are we saying that? It suppresses what? Ovulation, because of what? Oxytocin and the prolactin that comes into the system. And then the hormones that are responsible for ovulation, which are the progesterone and then the estrogen, are being suppressed. Therefore, there is no what? Ovulation. And then we are saying that as there is no ovulation, there is no way that the woman can be pregnant. Some women, they as they are breastfeeding, hardly do they get pregnant because they don't menstruate. So in the process, we have what? Alactational menorrhea. We have the lactational amenorrhea in the system because the woman is not menstruating, no production of the eggs. So anytime even the woman have affair with the husband, the sperm will never get any egg to fertilize. Therefore, no pregnancy. Because some people, within the first 6 weeks, they start menstruating. But if you keep on to breastfeed the baby exclusively, day and night, there will be no production of what? The eggs. So there will be no ovulation. Therefore, the woman will never get pregnant. Protection against ovaries and then breast cancers, or reduce the incidence of ovarian cancers and then breast cancer. So when we breastfeed the baby exclusively and then continuously, the incidence of ovarian cancer and then breast cancers are absent. It also forms as a control or preventive measures of what? Postpartum hemorrhage and then postpartum depression. Most women after birth may bleed, and some people may bleed to death. But when we start or initiate this breastfeeding for the first 30 minutes of delivery, this helps in what? Bringing about what? Promotion or reduction in bleeding. That is where we have the oxytocin coming in, bringing about what? The clotting mechanism. And then this oxytocin helps in contracting the blood vessels. So the blood vessels are constricted and contracted to prevent any further bleeding. So when you continue to breastfeed, there is production of oxytocin, which helps in what? Constricting the blood vessels so that no blood will be producing or constrict the vessels to prevent bleeding. And then postpartum depression. As you are feeding the baby, it takes off your stress, the joy, the love, the bonding that you have for the child all comes in and then takes off any depression in the system. It also gives the psychological and the emotional support to the mother during breastfeeding. As I'm saying, when you start breastfeeding, the joy and then the sight or the mind that the baby you've given birth safely, nothing wrong with you, nothing wrong with the baby, that joy alone, as you are feeding and then looking right into the eye of the baby, talking to the baby, it brings some emotional joy and then support to the mother. Now to the nation. When we are breastfeeding our baby, does it benefit the nation? In what form does it benefit the nation? We are saying that it helps with what? Family planning or spacing the child, hence decreases population growth. So if you plan that I'm going to give birth to 2 children, 3 children, if you're able to breastfeed a baby, you will never get pregnant by the 6th week or the 6th month. And then it will also decrease the population, that the government will be able to produce the amenities, the social amenities, and then other form. It will also reduce what? Social vices in the system. And all this brings about what? Development of the nation. And then the second point is saying that healthy baby, healthy family, and then healthy nation. If you are able to control yourself, feed the baby with the breast milk, the spacing of the baby is there. Therefore, this baby will never suffer from any malnutritional deficiencies. For instance, the baby suffering from kwashiorkor, marasmus, that's nutritional deficiencies will not come in. The baby will look healthy, because when we feed the baby with the breast milk, the baby look healthy and have all the nutrients that the baby need to grow. But as the baby is healthy, the mother will be healthy, because the mother is now spacing the child about 2-3 years before the mother will take another pregnancy. And when that happens, the mother look good. The mother can work for about 2 years before getting pregnant again. And then when the mother, because when you are pregnant, it's like the uterus is also sick. But when you give birth and then you wait for about 2-3 years, the uterus becomes healthy. You are able to work, plan, save money for the next child. And therefore, there will be nothing like any form of sickness when you are pregnant. And you'll be able to carry out activity without any stress. Healthy nation. If the mother is healthy, baby is healthy, the nation will be healthy, because the mother will be able to work, and then the nation will get money. The nation will not use any money to import drugs. If the baby is sick, day in and day out, the government have to import drugs into the system to sick to the baby. And you know, most of the babies or the children under 5 are well catered by the nation. They have to import drugs from outside. So when we are able to breastfeed the baby, space the baby very well, the nation, the importation of drugs and everything reduces, and that saves some income for the nation. Good. Immunization of the baby. Immunization. We need to immunize the baby after birth, so that they are being prevented from any form of what? Infection or the childhood preventable diseases. We need to what? Prevent the child from contracting these preventable diseases. What are some of them? We have the BCG that is given right at birth, and this prevents the child from contracting any form of what? Tuberculosis. We also have to give the polio O at birth to prevent the child from poliomyelitis. We also have the diphtheria, tetanus, the whooping cough, and then the rest, the yellow fever, and then the measles. We need to inform the caregivers about the importance of what? Obtaining recommended immunization, and should be received a written schedule as to when the immunizations are due. So when we go for the child welfare clinic, we need to write it in their weighing card so that they will know the next schedule and then when to come for the next immunization. We also have to do the recommendation for what? Routine where baby checks up, where they come to the CWC or the child welfare clinic so that the child is being monitored and then assessed from any infection. So some private caregivers schedule the meeting or the recommended routine visits as 1 week after birth, then 2 weeks, and then later on they move on to once a month, so that the weight is being monitored to find out any deviation from the normal. Others will also have all newborn returned to the facility 3 days, 1 week, and then 2 weeks. So the need for caregivers to receive a recommended schedule for follow-up care. We need to teach them. We need to alert them. Some of them who cannot read and write, we have to use activities that are being done in the community to schedule their visits. And then the need for us also to follow up in the community. We need to do home visiting so that those who have forgotten, we assess through their weighing card, and then if possible, we attend to them in their homes. Good. This brings us to the end of our first lesson for today. Thank you. Our next topic that we are looking at is the sick child. By objective, we are saying that by the end of the lesson, students should be able to what? Recognize the sick child, list the signs and symptoms of a sick child, describe the care of a sick child. How do we recognize a sick child? The most important factor in recognizing a sick child is the airway. Some of them, the airway are blocked and they have difficulty in breathing. Some of the blocking of the airway may be as a result of what? Meconium aspiration. It can also be the structured approach to assessing. So we have a structured approach in assessing the ill baby. We have the airway, we have the breathing, circulation, and then disability. We'll be taking each and every one of them and see how we assess the sick child. Airway. There may be an obstruction from the airway, and then this obstruction could be due to what? Large head, or small or short neck. Some of them may be as a flexing of the head. You know, when the baby flexes the head, the posture in utero, and then baby flexes the head, it obstructs the airway, the trachea, and everything. The baby cannot breathe. And then naturally, some people also have narrowed airway. So the airway will also be narrowed. And some of them can be due to different factors. Some can be due to growth in the airway or any other thing. It can also be due to what? Large tongue. When the tongue of the baby is relatively large, then the baby will have obstructed airway. And some of them, you know, with these babies, naturally they are nasal what? Breathing. They use the nose in breathing. As we adults, when we can use our mouth to breathe when we are being obstructed from the nose, we can use the mouth. But with the babies, they cannot use their mouth. They only use the nose. So when the nose is being obstructed, it's become difficult for them to breathe. So if the airway is patent, the only thing you have to do is to give oxygen. So quickly when the baby comes out, during your resuscitation, you need to what? Suction the baby so that you get rid of any fluid or anything obstructing the baby. You can also do that by using your finger to sweep the mouth of the baby. If there's no obstruction and the airway is clear, baby is crying, after you've assessed use your APGAR score in assessing the baby. Baby airway is patent. You only have to give oxygen. If no patent airway, you need to tilt the chin of the baby. You lift the chin of the baby, just as when we are doing the resuscitation. You lift the chin of the baby, jaw thrust, and then gently use your finger. Use your finger to sweep the mouth of the baby, or you also use suction machine to suction the baby smoothly. But you need to do it in a careful manner to prevent spasms. And when you promote spasms, then dyspnea or apnea will set in. So you do it gently. You use the finger to sweep the mouth of any fluid. Breathing. In breathing, we assess for the efforts and then effectiveness of the breathing. Let's look at the efforts. When we talk of efforts, what do we mean by effort? And we have this thing in assessing the efforts. We have the rate of the heart, the rate of the breathing. Is it shallow? Is it rapid? That is the rate. So you assess the baby, and then looking at the efforts, we are looking at the rate at which the baby is breathing. Is it rapid or shallow? Or is it sighing? And then the next one that we can assess the effort is recession and then indwelling. Some of them, you see that the chest draws in when they breathe. They take in one breath, the chest indwells in. We also have nasal flaring. You see like the nose will open and close, the nose open and close. We also have grunting respiration, where you see some noise, the wheezing and then the grunting respiration, some noise being produced as the child or the baby tries to breathe. We also have stridor, with this sound coming after the breathing. So we use the stethoscope to assess this stridor and then the wheezing sound. Now let's look at the respiration rates. I've told you that with the respiration, we are looking at if it's rapid or shallow. Then based on their ages, we can determine the rate. Less than 1 year, we have 30 to 40 rates per minute. Between 1 to 2 years, we have 35, 25 to 35. 2 to 5 years, we have 25 to 30. And then 5 to 12 years, we have 20 to 25. And then above 12 years, we have 15 to 20. So normally we say that with the children, less than 1 year is 30 to 40. So our normal respiration for adults lies between 15 to 20 beats per minute. Now, how do we assess the effectiveness? With the effectiveness, we are looking at the chest movement. How does the chest move? How does it move? You can assess the effectiveness of the respiration or breathing by looking at the chest movement. So if the child is able to breathe one, then the chest goes down, moves up, comes down, then you can say that the effectiveness is good. We also assess the effectiveness by looking at the air entering into the baby. Is there any obstruction? If the baby is having enough hair, the color of the skin of the baby will change. So if the chest is able to move up and down, that tells you that air entering into the body is good. And when we see enough air entering into the body, the skin color of the baby will change. You could remember that in APGAR score, in our previous lesson, We are looking at the appearance. And appearance, we are saying that is the what? Color of the skin. So when the appearance is good, the color of the skin is also good. It means that the air entering into the body is rich enough to change the color from blue to pink. Then oxygen saturation. If the air entering into the body is good, the child or the baby will be supplied with enough oxygen, and then the baby will have good oxygen saturation. And then with that, the heart rate will also increase. There we can say that the baby conscious level will also be good. So these are the things we use to assess the effectiveness. We look at the chest movement of the baby, the amount of air entering into the baby. Then if good air is entering into the baby, the color of the skin will change from blue to pink. And then oxygen saturation will also be good. The heart rate will increase nicely, and then the conscious level will also be good. Now, circulation. In assessing circulation, we are looking at the heart rate. Is the heart rate rapid or shallow? We are also looking at the urine output. We are also looking at the blood pressure. And then hypotension is a late sign. So if the baby, and normally with babies, we don't measure their blood pressure. But with time, we put them on monitor, and then the monitor is able to detect their blood pressure. With the urine output, if the blood circulating in the system is enough, the baby will be able to form urine, and then the urine output will be good. Let's look at the heart rates for each age. The heart rates per age. Less than 1 year, we are saying that the heart rate is between 110 to 160 per minute. 1 to 2 years, we have 100 to 150. 2 to 5 years, 95 to 140. 5 years to 12 years, 80 to 120. And then with 12 years, 60 to 100. So this is where the heart rate, and with the babies, we can determine the heart rate using the stethoscope. Now let's look at the disability of the baby. We talk of the conscious level, and then we also use the pupils, and then the posture of the baby to assess the disability of the baby. To assess for the conscious level, we look for the following: the alertness of the baby, the voice of the baby or the cry of the baby. We also assess for pain and then unresponsiveness. And you could see that these have some relationship with the APGAR score. The alertness or the activity of the baby is what we look at, the muscular activity. That tells us the alertness of the baby. And then with the voice, that is the cry. And then assessing for pain. And then how does the baby respond to the pain? So this is how we assess what the level of consciousness. Then assessing the pupil in the eye. The pupil may be brown. The pupil may be brown. But with time and then breastfeeding, the color of the pupil changes. To assess for the posture, we look for the following: abnormal fleshing. How is the baby fleshed? Then an abnormal extension of the baby. What are the signs of a sick child? What are the signs that you see in a sick child? 1, fever. Fever itself, we are saying, is not an illness, but rather the baby responds to an illness, most commonly infection. So when the baby have infection, the baby may develop what? Fever. So the moment you see any fever or temperature above 39.3 degrees Celsius, you need to report to the hospital. Or if your baby is between 3 to 6 months and has a temperature above 40 degrees Celsius, you need to call your doctor. So these are some of the things. The fever is the number one sign that you see in a sick child. And you can even determine that when you are breastfeeding the baby, the temperature of the mouth will change. So the moment you put the nipple in the breast, you can feel the temperature of the baby. And that will tell you that the temperature of the baby is high. And then you need to do something about it. So when you are recording this temperature of the baby, quickly you need to what? Report to the doctor. So these are some other things that you need to call the doctor when your baby is having these signs. 1, rashes. When the baby is not feeding well. When the baby is having stiff neck. And that will tell you that the baby is either trying to develop meningitis or tetanus. When the baby is also irritable, you are doing everything, and the baby is still crying. When the baby is also finding it difficult to breathe, you need to report to the doctor. And then when you also have persistent vomiting and diarrhea, you need to report. Then when the child is also showing signs of what? Dehydration or lethargic or difficult to arouse, you need to what? Report these signs to the doctor. So let's look at dehydration. How would I identify dehydration in a sick child? When the baby is feeding poorly, there will be dehydration. Baby has a fever, and then it's in a warm environment. So normally when they are in warm environments, they try to what? Produce heat. And then when this heat is being produced, they sweat. As they sweat, there's evaporation taking place. So this fluid is being absorbed into the atmosphere, and then the child will become dehydrated. We did this one in our previous lesson when we are looking at how we prevent heat loss in the child. Also, when the child is having persistent diarrhea or vomiting, the child will be dehydrated. So we recognize dehydration in these various forms. So you can recognize dehydration if the baby has a dry mouth and gum. So you can see from the mouth of the baby or even the lips of the baby that the baby looks dry. The baby wets the diaper less frequently. So for instance, you put on the diaper on the baby, and then for the past 12 hours, no production of urine. Then it will tell you that the baby is having some form of dehydration. Then when the baby shares no tears, you see the baby crying, but no tears is coming. That will also tell you that the baby is dehydrated. And then the next one that is a typical sign that shows that the baby is having dehydration is when you have the fontanelles, especially with the anterior fontanelles, where we have the diamond shape sinking or sunken in. You see that there is much depression in the anterior fontanelle. That is a number one sign that you see in a baby with dehydration. Diarrhea. Diarrhea is also another common condition or sign in the infant. So when you see any diarrhea continuous frequently, you need to what? Inform or send the baby to the hospital. We have a normal one. Some people mistakenly use the first 3 days where the child has to pass the meconium. You've learned that colostrum help the baby to pass the meconium in the first 3 days. And this will be as a form of what? Watery stools. So some people mistakenly take it as what? Diarrhea. But it's not diarrhea. It's as a result of what? Or the effect of the colostrum. That is serving as what? A form of laxative that helps the baby to pass this meconium. Aside that, if the baby passes more than 6 watery stools per day, you need to report to the hospital. Some of these watery stools may contain blood in it. Please, we don't have to wait. Some of them are bright red, some of them are dark. We don't have to wait, but quickly report it to the hospital. And then also, the baby is not taking in fluids or show no signs of what? Show signs of dehydration. There you have to know that the baby is having diarrhea. Also, they also have signs of what? Vomiting. Infants commonly spit up, but frequently vomiting is reason for concern. Some of them, after feeding, breastfeeding, you see them bringing out what? Some of the milk that they've taken. Once a while, you see this fluid coming out. But others too may vomit, and this spitting up of the milk is different from vomiting. So when you see the baby after feeding, and then the baby tries to bring out, frequently we need to report. Vomiting may not be serious if it happens only once a while, as I said early on. Just sometimes it may be due to overfeeding or regurgitation. So it's not serious. But if you see it more often, frequently, and some may contain blood, or some may even contain gray substances, these affect the child, and then it looks that the baby will become dehydrated if the vomiting continues. So you need to inform your doctor. Another sign is difficulty in breathing. And this comes in various ways. So you need to inform your caregiver about this difficulty in breathing. Because some of them, as they continue to have difficulty in breathing, there may be obstruction in the trachea or the airway. So what are the signs that you see with a child with difficulty in breathing? They said breathing is much more rapidly and then unusual. You've assessed the baby, you brought the baby home, baby is able to breathe slowly, nicely. And this breathing depends on the state of the child. Is the child sleeping? Is the child playing? Is the child crying? Is the child taking any vigorous activity? So the breathing of the baby depends on the activity of the baby. But with the sick child, the breathing may be rapid or what? Shallow. And then also you could see that the baby is using all the tissues of respiration, like the ribs. And then you also see the collarbone of the baby in between the collarbone and then the clavicle. You have some deep down there. And then also the sternum also having in the indwelling. So you see this baby with all these signs, trying to use all the respiratory muscles in breathing. The baby may also have this grunting respiration after bringing air out. And then the lips, the baby lips and skin may also develop what? Bluish. That is, cyanosis is setting in, which means that the baby is not getting enough oxygen. So when the baby is having difficulty in breathing, all these signs may be seen. Redness, oozing, and bleeding. Because the baby's skin is very delicate, we also have the umbilical cord. The baby may have bleeding from the umbilical cord, maybe circumcision, or the skin. If the delivery process is not well done, you know the blood vessels some of them are being exposed. So with a little scratch, the skin starts to bruise. So you see this bleeding and then oozing of blood from the skin or the umbilical cord. So if care is not taken, the baby can bleed to death, especially with circumcision. So these are the signs of, as a result of the redness, especially when you see redness and temperature, it's a sign of infection in the baby, and then quickly you need to send the baby to the hospital. Now rashes. Some babies, right after birth, 2 to 3 days, you see these babies having rashes on their skin. We may have the pemphigus, Otamian and Atorium, some form of rashes may also be there. But especially with pemphigus, that is where you see these rashes. Some of them may be small, others may be big. So when you identify these rashes, some people may say it's as a result of what? It's rash. But you need to assess the form of rash on the baby. Exactly where the rash is also appearing. Especially you see these rashes on their face, their cheeks, and then around the neck. So you need to assess the rash, and then quickly you inform your doctor about the rash and then the area, especially with the face and then and this rash too, some of them may be accompanied with fever, the bleeding, and then swelling. So it depends on the type of rash and then where it's occurring, and then quickly you see what to do to it. Because some of them may be infected, so you look for infection around this rash. Cold. At times I wonder why children or babies may suffer cold, but it occurs. Upper respiratory tract infection are caused by what? Virus and then other forms, and are very common in infants. They usually last 1 to 2 weeks if associated with what? Running nose, fever, poor appetite. So some of this cold, within 2 weeks of life, the baby may have it. And then you see the baby having running nose, fever. Very, very common when they are having this cold. You see them having temperature. And then they are not able to feed because you know they cannot breathe through their mouth. They only breathe through their nose. So if the nose is being blocked, they find it difficult in feeding. And they use energy when they are feeding. So if they are not getting in enough oxygen for them to use it, then they find it difficult to eat. There may be cough, and the more serious symptoms requires what? Doctor's care. Good. That brings us to the end of our lesson for today. We'll continue another time. So we've been looking at resuscitation, how to resuscitate the baby. And then also we look at how to groom the baby, the daily care of the baby. With the resuscitation, we look at the various requirements that we need: your oxygen points, your suction machine, your light source, your resuscitation table, and then how to even position the baby during resuscitation, and then the things that you need to do so that you prevent the baby from injury. We also see the daily care of the baby, how to bath the baby, how to groom the baby, breastfeeding, taking the weight measurements, immunization. And then also we look at the sick child, the signs and symptoms of the sick child. How will they look like? Where they have the fever, they have the diarrhea, the vomiting, the skin rashes, and at times bleeding, and then with common cold. So that brings us to the end of today's lesson. Thank you and goodbye. I hope you've enjoyed the lesson for today. Thank you. Bye.